give a big hand to our chief guest, Rajendra Kumar Garu.
Thank you very much, Andy, Dr. Guru. It's very, very kind of you to invite me to be with you. And as a policeman, I'm least qualified to address the doctors. After what all you have said. Having said that, I think I'm the only qualified person to describe or to speak about what doctors have done to me. I don't think any one of you has spent as much time as I spent in an ICU. How many of you have spent your time in ICU bed? Hardly anyone. Imagine a situation, half a dozen AK-47 bullets from a 50-yard distance shot at you, close quarter, in a suicide attack. You are hit, your femoral bone is shattered, your femoral artery is shattered, right? By the time you reach hospital, your pulse is hardly felt. That was the position on May 21st, 2006 in my case. Badly shot, injured, rescued by my gunmen, taken to the first hospital close by in Srinagar. I'm talking about in Srinagar, as a police chief at that point of time. There they have done the basics, then they said no, he has to be taken to there is one Sher-e-Kashmir Institute of Medical Sciences. It is patterned on AIIMS. The doctors are the best, simply. They are all local doctors. Now, that was the portion they have recorded. Pulse hardly felt, total loss of blood. It happened around 12:30 in the afternoon. By the time I reached the second hospital, the final one, it was around 6 in the evening. 5 days there, a couple of attacks were made on the hospital by the terrorists to get at me. Then the government decided to airlift me, to shift me to, initially they thought of sending me to AIIMS Delhi. In fact, the doctors from AIIMS were also flown to Srinagar to see me and to advise the local doctors there. They said what the local doctors have done was perfect. Then subsequently, when they asked my wife, my brother-in-law, who is a doctor here, he also flew down to Srinagar. Then they said, okay, then instead of going to Chandigarh or Delhi, Hyderabad has better facilities and the emotional backup support would be there. Whereas I had my full confidence in the doctors who were treating me there. The organizational backup was there. Everything was available. It was just 2 days before the Prime Minister's visit to Srinagar. This has happened. Well, then I've been shifted here to Hyderabad. Came to care by air ambulance. But the doctors, when I landed up here, the doctors, I could not believe. They had to open my leg once again. Initial understanding was they may have to amputate my right leg below the knee. They were not sure about the vascular surgery. They have to take a vein from this leg, from my left leg. I believe they have reversed it, put it on my, grafted it into my femoral artery. They restored the blood supply in time. And that's how the leg, it's not only the life, the leg was also, the limb was also saved. The doctors still here, they couldn't believe. They opened, they saw it's perfect. Now comes the reunion of the shattered femoral bones. Both of them were literally dead, both the sides, and there was about 10 gap where the bone, the splitters have gone. Now that they need to fill up. It took another half a dozen surgeries by Dr. B.N. Prasad, if you know him, the orthopedic surgeon. He was also the fastest surgeon even for the Dr. APJ Abdul Kalam. He and his team of doctors, I would say they performed a miracle. 6 months was the time I was on bed. They made me walk. They did all the surgeries. They did their best. However, when I kept on questioning various things, they didn't have a lot of answers to my questions. So they gave me all the orthopedic books. So I become a part orthopedician now. Then one humble answer from the doctors was, finally when I got fine, within 1 year again I put on my uniform, back into action, and I started from where I fell. So this right leg, you can see it, not a centimeter of difference. This completely reconstructed this leg. Lot of debridement, lot of muscle has been lost. So doctors' humble answer was, we did nothing, we just joined them and we left it to God. It's a God who has cured it. That's the humbleness of doctors. None of them claimed. None of them said, oh, we did this, we did falana. They said, no, we just did whatever was required to be done, and then it's a God. Now those doctors are my best friends. Having said that, now of course we're talking about, it's really a great occasion to honor you all. I deem it as my honor on the birth anniversary occasion of Dr. APJ Abdul Kalam. I don't know how many of you have met him. I met him personally on more than 2-3 occasions. As the President of India, he was visiting J&K, he was visiting Kashmir as the police chief, local police chief. I handled him, a very, very simple man. In fact, for the corporates and others, people who are making money not for the normal doctor, but those corporates, those hospitals who were making money, he would be seen as a culprit because he has come out with a stunt which used to cost lakhs of rupees. He along with Dr. Somaraju, they have come with Kalam Somaraju stunt, and zoom has come down the cost of the surgery, and the stand it has come from I think 2 lakhs, 20 lakhs, 2 lakhs to 3 lakhs, it has come down to 20,000, 40, 50,000 to 20,000 now. That's what this great person has done. So I had the opportunity, I was fortunate enough to meet him in flesh and blood. Maybe another 50 years or 100 years down the line, people may start wondering whether such a man ever existed. Like Einstein said about Gandhi, he said, I wonder whether this man by name Gandhi has ever walked in flesh and blood on this earth. I think similar thing, I'm sure, people would talk about Dr. APJ Abdul Kalam. Now, gentlemen, thank you so much for giving me an opportunity, for inviting me to be here. It's a real privilege to be interacting with all of you. And my best wishes and my congratulations to all the doctors who have been awarded this. And let me also tell you, as the CEO, I'm also the Chief Executive Officer of NTR Memorial Trust. We also do similar things what Doctor does. We operate in the fields of education, health, then providing safe drinking water, then employment, livelihood, and disaster response and relief. We have intervened in all these situations. One small example, from the trust side, we have conducted so far more than 8,000 medical camps and a database of 19 lakh beneficiaries is with us. Every month, we organize minimum 15 medical camps at one place or other. So I'm glad, I never knew about ACT now. Yes, for the first time I heard you have done such a good job. And similar thing we have done, the doctors are so selfless Like I said, if 19 lakh beneficiaries are there, we got doctors free of cost. They came voluntarily and they helped us out. And only small little things, disposables, we were providing. Otherwise, doctors came and worked voluntarily with us. And during COVID, again, we have seen we organized a lot of telemedicine. Yes, worked physically. We could organize a lot of telemedicine and teleconsultations, even the doctors who were stationed abroad. We used to get them early in the morning. We used to organize teleconference, patch up using technology, patch on to the patients, get to talk to them, give them that confidence. There are a lot many things, of course. Now, anyway, it is his day today. I would not be talking about the one which I am doing. And you're doing a wonderful job. We are with you anytime. Feel free to get in touch with us. We'll work together.
Thank you.